My name is Mohammed Saifuddin. I'm a registered nurse with the Children's Special Healthcare Services Program in the Washington County Health Department. I work with my colleague, Colleen Warner. We're two nurses for this program. A typical day in this program, and this is a highly specialized program for kids with special medical needs. We have over 1,300 clients in this program in Washington County. Typical day would be making welcome calls to newly enrolled clients. From those welcome calls, we're typically finding other issues related to the client, to the family, social, psychological, medical needs, financial needs, and that really opens up and blossoms as we move along. May schedule home visits with that. Then we're taking phone calls, emails, text messages with a variety of problems, billing, supply, appointment issues, challenges, barriers our clients have. So we call it a typical day, but we have many atypical days. It's a very fluid program.
Hi, my name is Colleen. I'm a registered nurse with Children's Special Healthcare Services. I am an alumni of Eastern Nursing Program. Just want to plug that in. A typical day is basically what Mohammed said, and then yesterday was a typical day of doing a plan of care. For me, I had to visit medically complex children, and what I did with them was I read over about 5 medical reports prior to going in, gathered my folder up with different brochures that would help explain things better to the family, so that after I leave, they would have something to read. And I made a contact with social work from U of M Hospital at Physical Medicine and Rehab to help get some durable medical equipment that was needed for the family, and then worked on some psychosocial issues that I did discuss with my social worker supervisor after I met with them.
All right, so I'm Christina. I'm with Children's Special Healthcare Services, and I'm a social worker. So part of my role in Children's Special Healthcare is really kind of to help the nurses with any of the psychosocial issues that might pop up. We do a lot of discussion about community navigation. One of the things we do as a team, once a week we get together, we look over some of the new medicals and kind of go through there and see what's going on. Are families having issues around maybe medication compliance? Looking for any psychosocial issues that might pop up, and kind of looking at who might benefit from maybe more intensive contact from us in the program.
We're collaborating all the time. Colleen's office is next to me, so I can hear her and she can hear me. We have like rice paper walls, it seems like. So a lot of times she might be on the phone and she's looking for something, and number I just go over and give her to her. She might hear me, come over, and we discuss complex cases. Typically we review also our complex cases. We'll let Christina know what's going on. There isn't one particular case we've all collaborated on, but one of the things I think I go to Christina the most about is our combined maternal infant health patients or clients, and they're also enrolled in Children's Special Health. Because my forte is not babies, infant care. So I'll typically ask Christina, as well as the other team members and nurse social workers, how to proceed with that, and also to work as a team so we're not doing redundant things, so I can assist them where I'm best to serve those clients.
So I also work with Mohammed in the same aspect, with the rice walls. And then with Christina, an example would be yesterday when I came back before I went to my plan of care, I had read the medical and realized that the family was also in recovery from substance abuse. So we talked about that a little bit, and how we can best help them with that. And then I also collaborate with MyHep with Mohammed and Christina. And MyHep, I do have a MyHep background. I worked in MyHep prior to coming to Children's Special Healthcare Services, so that does help me, but some things have changed, so I will, collaborate with the MyHep nurses and with the social workers in that aspect.
So with one of Colleen's clients, I recently went out. She's been working with this family for a long time, many years, and so the family's been having some difficulty with some utility issues, potentially having a shutoff, and so just went out to the home, met with the family, kind of reassessed. Colleen had gone out and previously had done a plan of care with the family, so kind of reassess where things stood, if anything was resolved, if there were new issues, just to kind of get an idea of how the family was progressing on some of the issues that had initially been identified, and then set up a plan with the family, and then came back and coordinated with Colleen, letting her know what had been followed up on, what upcoming appointments there were scheduled for that week, and then what things that we still kind of needed that were outstanding and needed to be resolved.